Okay, class. So this will be the last part of your organic chemistry. Number 220 to 300. 220 to 300. So first 220. Which of the following chemotherapeutic agent is not bactericidal? Not bactericidal meaning bacteriostatic. So the question, which of the following chemotherapeutic agent is bacteriostatic? The answer is erythromycin. So the rest, such as your carbonicillin, gentamicin, cefuroxime, and vancomycin, are bactericidal. So your erythromycin, and the rest of macrolides are generally considered to be bacteriostatic. However, at higher doses, they can be bactericidal in character. So at higher doses, your erythromycin may be cidal or bactericidal. 221. All of the following statements are true concerning the penicillins except letter D. They are obtained from the genus of Streptomyces. So your A, B, C, and E are the definitions of your penicillins. So your penicillins are obtained from strains of Penicillium notatum and Penicillium chrysogenum. So again, they are obtained from Penicillium notatum and Penicillium chrysogenum. 222. In choosing a specific benzodiazepine for the treatment of insomnia, all of the following are considerations except your mental status of the patient. So the following factors for the treatment to be considered for the treatment of insomnia are the age of the patient, the half-life of the drug, the absorption of the drug, the underlying sleep disorder being treated. So your mental status of the patient is not a factor in treating your insomnia. Number 223, an antibiotic most commonly used in topical preparations is your bacitracin. So bacitracin has found its widest use in topical preparations for local infections. So it is not absorbed from the GI tract, and so oral administration has no effect except for the treatment of amoebic infections within the alimentary. So bacitracin for oral administration, it has no effects, and so bacitracin are mostly used as topical preparations such as creams, ointment, and even lotion. 224. The preferred agent for hypertensive emergencies is your sodium nitroprusside. Sodium nitroprusside. So it is the drug of choice in treating hypertensive emergencies. Hypertensive emergencies meaning ang BP niya is over 150 over 150 to 210 in its systolic blood pressure. So for BP over 150 to 210 systolic blood pressure, ang ginagamit nilang drug of choice is your sodium nitroprusside. Sodium nitroprusside. Okay. 225. Superior to acyclovir in the treatment of herpes viruses in the CNS in neonates is your vidarabine. So, your vidarabine penetrates into the brain and is effective in the treatment of herpes simplex encephalitis. So, vidarabine is used preferably in the treatment of herpes simplex encephalitis, and yung mechanism of action niya is penetration into the brain. 226. Which of the following bases is most susceptible to alkylating agents is your guanine. So your guanine is most susceptible bases to alkylating agents. To 27, vincristine is used primarily in the treatment of which of the following? Letter A, Hodgkin disease. So vincristine is effective against acute leukemia, and also it is used in combination chemotherapy for Hodgkin disease. So primarily vincristine is effective against acute leukemia. So vincristine in combination with chemotherapy, it is used in the treatment of your Hodgkin's disease. 228. For the treatment of systemic mycosis, which of the following antifungal agents can be administered by IV route? That is your amphotericin B. So your amphotericin B is the drug of choice in the treatment of systemic mycosis, and it is administered by intravenous infusion. 229. Penicillin is the drug of choice for the following infective conditions except pseudomonal infection. So, the rest, your gonococcal, pneumococcal, treponema pallidum, streptococcal infection, these conditions are treated by your penicillin, except your pseudomonal infection. (230) All of the following drugs act as prodrugs and need to be converted in the body to active compound except salbutamol. So your levodopa, prednisone, bacampicillin, and cyclophosphamide act as prodrug, and they have to be converted in the body to active compound. So for your levodopa, the active drug is dopamine. For prednisone, the active drug is prednisolone. Your bacampicillin, active drug is ampicillin. And your cyclophosphamide, active drug, phosphoramide mustard. So these are the prodrug, your levodopa, and when converted, it will be converted into dopamine, your prednisone to prednisolone, your bacampicillin to ampicillin, and your cyclophosphamide to phosphoramide mustard. 231. Drug of choice for scabies is benzyl benzoate. So your benzyl benzoate is an effective scabicide when topically applied. This is due to its local anesthetic effect. So your benzyl benzoate again is an effective scabicide when applied topically, and it is due to its local anesthetic effect. 232. The sensitivity of gram-negative bacilli to amoxicillin is due to its amino group. So the presence of your alpha amino group such as your ampicillin and your amoxicillin creates an additional asymmetric center, and it is noteworthy that the extension of antibacterial spectrum brought about by the substituent applies only to the D isomer, which is 2 to 8 times more active than either the L isomer against various species of gram-negative bacilli. So, mas effective yung D isomer ng alpha amino group as compared to your L isomer against your gram-negative bacilli. So, ang ginagamit nila is your D isomer alpha amino group. 233. Bone marrow depression resulting in pancytopenia is the characteristic toxic effect of all of the following drugs except oxytetracycline. So, some adverse effects of the tetracyclines are GI disturbances, vertigo, liver failure, phototoxicity, and deposition of drugs in bones and teeth, especially in children. The following antibiotic possess clinically useful anti-malignant property except streptomycin. So your mitomycin, bleomycin, daunorubicin, and plicamycin are clinically useful as in anti-malignant property. So these are your antibiotics used in cancer therapy because they have anti-malignant property. So memorize this: mitomycin, bleomycin, daunorubicin, and plicamycin. NBDP. So they are used as in the treatment of cancer therapy. 235. This is the process utilized by Florey and Shane in isolating penicillin. Is freeze drying. 236. The metabolite of the red dye prontosil responsible for its antimicrobial property is sulfanilamide. 237. Which of the following antiviral agent is not useful for the treatment of herpes virus infection? The answer would be interferon. So your interferon is a family of naturally occurring inducible glycoproteins that interfere with the ability of viruses to infect cells. And also, it has been approved for the treatment of hepatitis B and C as well as against cancer such as hairy cell leukemia and Kaposi's sarcoma. However, your interferon is not used as antiviral in the treatment of herpes virus infection. So what are your antivirals for herpes simplex virus? These are the following: vidaribin, acyclovir, idoxuridine, and trifluridine. 238. All of the following chemotherapeutic agents are useful for prophylaxis against infection caused by specific microorganisms except chloramphenicol against typhoid fever. So your chloramphenicol is not used for prophylaxis but for the treatment of typhoid fever. So the rest, your amantadine, isoniazid, tetracycline, and pyrimethamine are useful for prophylaxis against infection. Your chloramphenicol is not a prophylaxis, however, it is used as a treatment for typhoid fever. 239. The therapeutic uses of amphetamines does not include which of the following? Hypertension. So the major causes of behavioral effects of amphetamine is probably due to the release of dopamine rather than the release of norepinephrine. The CNS stimulant effects of amphetamine have led to their use in the therapy of depression, hyperkinetic children, narcolepsy, obesity, and hypertension. And Parkinsonism pala. Your hypertension is the only exception. So your amphetamine is used in the treatment of narcolepsy, obesity, Parkinsonism, and in hyperkinetic children. This is due to the CNS effect of amphetamine. CNS stimulant effect of amphetamine. 240. Nitrous oxide, a general anesthetic agent, is characterized by all of the features of which of the following groups? Low potency, good analgesia, poor skeletal muscle relaxation. So your nitrous oxide is a potential analgesic. However, it is a weak general anesthetic. And so it is frequently combined with other potent agents. So this anesthetic does not depress respiration, nor does it produce muscle relaxation. 241. A drug receptor may be all of the following except chelates. So a drug receptor may be an isolable enzyme, ang functional component of a cell membrane, a protein, or a nucleic acid. So the exception here is it is not used as a chelate. 242. Mechanism of action of trimethoprim is folate reductase inhibitor. So the active form of folate is tetrahydroderivative that is formed through reduction by dihydrofolate reductase, and this enzymatic reaction is inhibited by trimethoprim. Ayan. So your trimethoprim inhibits the enzyme folate reductase. Inhibition of folate reductase. 243, a drug molecule which possesses both intrinsic activity and affinity is your agonist. So, agonist is a drug molecule which possesses both intrinsic activity and affinity. 244, chelating agent that is an effective antidote for copper poisoning and used in the treatment of Wilson's disease is your penicillamine. So, your penicillamine is used as a chelating agent in the treatment of heavy metals and as an antidote for copper poisoning and in the treatment of Wilson's disease. 245, which is not a chelating agent, that is your 8-methoxyquinoline. So the rest are chelating agents. 246, dimercaprol is also known as your BAL or your British anti-leucine. Dimercaprol is also known as BAL or British anti-leucine. 247, synthesized from dry hydrogen chloride and carbon monoxide at 300 degrees and 200 atmospheric pressure is your tetrachloroethylene. So, tetrachloroethylene synthesized from dry hydrogen, chloride, and carbon monoxide at 300 degrees and 200 atmospheric pressure. So, the use of your tetrachloroethylene is used as an anthelmintic. This is due to its local irritant properties, primarily used in the treatment of hookworm infestation. So again, the effectiveness of tetrachloroethylene is used as an anthelmintic, particularly in the treatment of hookworm infection due to its local irritant property. 248, passive diffusion includes what drug? Letter A, lipid-soluble drugs. So, your lipid-soluble drugs readily move across most biological membranes through passive diffusion. 249, it is the tendency of the drug to combine with the receptor. That is the definition of your affinity. Affinity, it is the tendency of the drug to combine with the receptor. 250, brand name of bisacodyl, Dulcolax. So, the brand name of bisacodyl is Dulcolax. Letter B. 251, Pen-G is also known as your benzyl penicillin. Pen-G is also known as your benzyl penicillin. 252, organosilicon polymers containing oxygen and silicon atoms with a substituent organic groups. Letter A, silicons. 253, a phenol primarily obtained from the clove oil, eugenol. So, eugenol is a phenol primarily obtained from clove oil. It has local anesthetic as well as antiseptic, and it is used to relieve toothaches. So, eugenol is a phenol obtained from clove oil, and it has local anesthetic, antiseptic, and it is used to relieve toothaches. 254, Which of the following is used in the treatment of pernicious anemia, that is your vitamin B12, or also known as your cyanocobalamin? So it is used in the treatment of pernicious anemia, cyanocobalamin, or your vitamin B12. Your thiamine is your vitamin B1, riboflavin is your vitamin B2, your niacin is your vitamin B3. Classified as a macrolide antibiotic except bacitracin. So your macrolides are erythromycin, spiramycin, and oleandromycin. ESO. Mnemonics: ESO, erythromycin, spiramycin, and oleandromycin are macrolide antibiotics. 256. A macrolide antibiotic which was found in the soil of Iloilo is your erythromycin. So it is your erythromycin was found in the soil of Iloilo, erythromycin. 257. The following antimalarials are synthetic drugs except your quinine. Your quinine is obtained from the bark of Cinchona species. So it is also used as an anti-malaria. The rest are synthetic drugs which is also used in the treatment of your anti-malaria. Your atabrine, aralen, and your camoquine. Your quinine is a natural drug obtained from the bark of Cinchona species. 258. Polyene antibiotics for fungi includes your amphotericin B. Letter A. From Streptomyces nodosus. Your amphotericin B is obtained from Streptomyces nodosus. Your nystatin from Streptomyces norsei. So your polyene antibiotics includes amphotericin B and nystatin. So your amphotericin B is obtained from Streptomyces nodosus, and your nystatin from Streptomyces norsei. 259. Also known as solvent shift. This is your letter C, bulk transport. Your bulk transport is also known as your solvent shift. 260. Externally, ethyl alcohol is employed as refrigerant, rubefacient, astringent. So letter D. The primary medical use of alcohol are external as antiseptic, preservative, mild counter-irritant, or solvent. Also, your rubbing alcohol is employed as an astringent, rubefacient, refrigerant, and mild local anesthetic.